Friends, this ICMR report is clearly indicating about the prevalence of diabetics and pre-diabetics. And they are saying that each for every diabetic patient there are 3 4 pre-diabetic patients. The problem is for many times, in not many times, few cases, diabetics don't have any symptoms, and only when they get the blood test they realize that the HbA1c levels are above 7.5. I've seen some cases where there are absolutely no symptoms, but their HbA1c is 10%, 11%. So, friends, it is necessary that you need to do HbA1c test to know your diabetes. Now, pre-diabetes, somebody saying there are symptoms, there are zero symptoms. What are the basic symptoms, unhealthy symptoms? Number one is the overweight, two is large waist size, and any blood pressure. If these three or any one is there in the body, consider you are having a pre-diabetic situation. Unless you check your HbA1c, you don't know. So, friends, it is a must. We must check those HbA1c tests. See, before a person is pre-diabetic, he will be insulin resistant for many years. The point is, again they are saying many pre-diabetics may not become diabetes. Friends, it is the root. See, after LKG, people don't go into 10th standard, they go to UKG. After UKG, first standard. Similarly, people start with insulin resistance first. Over a period of time, while in insulin resistance itself, they will be gaining weight, they will be developing belly fat, they will be developing blood pressure, and in some cases, ladies, PCOD problem will be there, blood pressure is there. So then pre-diabetics will happen. That means pre-diabetic means you have already crossed most of these stages. After pre-diabetes, somebody can go to diabetes. Yes. See, externally you see people have different strength of organs. Somebody is very tall, somebody is very strong hands, strong legs. Similarly, internal organs also like that. For somebody, the pancreas is very, very strong. So a person may be overweight by 20 kg, 30 kg, and a person is around 60, still they are not pre-diabetes. The beauty is their pancreas is very strong. In some cases at the age of 18, I've seen people at the age 18, they are pre-diabetes. So let's not go by that. Check your parameters. As I keep telling you, these 10 parameters a must. What are the 10 parameters? Your weight should be as per your height. Waist size should be half of your height in inches. Blood pressure should be below 120 by 80. Below. And then your fasting insulin should be 3 to 5. The lab saying 25. Don't go by that. 3 to 5. Fasting sugar should be below 99 milligram per deciliter. With the fasting sugar and fasting insulin, you can calculate insulin resistance. How to do that? Fasting sugar multiplied by fasting insulin divided by 405, the value should be below 1.5. That is insulin sensitive. If it is above 1.5, it is insulin resistance. Let me tell you, friends, 90% of the population are insulin resistance of various degrees. Only thing is that we are probably at a lower range of insulin resistance. Then you must check lipid profiles like HDL to triglycerides. Triglycerides should be below 100, HDL should be above 60. D vitamin, again it's very low for many people. It should be between 50 to 100. The lab is saying 30 to 100 is okay, but preferably it should be above 50. Similarly, B12 should be 500 to 900. Lab maybe say 290 to 900. So keep that in mind. I've seen the case study. In fact, that person had shared his report in the group also. His B vitamin is, I think, around 30 40, and he has been having problem for quite some time. But since he was living in a small remote place, he got the test done recently. I'll just share the report once again for you to understand. So all of you must take note of this. Majority of the people are insulin resistant, and many of them are pre-diabetic. Lots of people have D vitamin, B12 deficiency, and of course lipid profile problem is there. Why? All this is because of one primary reason, rather not one, many, but primarily multiple times eating. We are eating breakfast, lunch, dinner, snacks, coffee, tea in a day. We are eating 6 to 7 times. That is the main reason to increase your fasting insulin levels and over a period of time insulin resistance. On top of it, if somebody is taking high carb foods, that's all. Probably people at the age of 18, 19, they're pre-diabetes and they're highly insulin resistant. They're overweight. They are also having low D vitamin and B12. Friend, this group is primarily meant to stress upon this health score. I keep on telling you, participants should be active. They cannot be spectators. Then only you can make use of it, friends. Thank you very much. Pay attention. In this group, I only want people to share their experiences. Suppose by watching some video they have benefited, they can write that thing. If you simply forwarding any video, best of video will not be accepted henceforth. Anybody is forwarding such videos, we will remove them summarily from now on. So we want to be more serious. We want people to get benefit. Thank you very much for listening.